Hello, everybody. Welcome to Indiana SHIP's Lunch and Learn Thursday. I'm Susan with SHIP, and today's topic is hospice care. So, we're going to talk about hospice care. What is it? When do you use it? And specifically, how Medicare covers that benefit. I'm joined by my co hostess, Megan Rogers.
Morning, Susan.
Hi. And we have a special guest today, Dawn Boyles, who is a hospice social worker. So Dawn's going to share with us the role of a social worker and some information about hospice in general at first. And then Megan has prepared a presentation about hospice benefits and Medicare. Thanks, ladies, for being on today and presenting this important information for people. If folks have questions, just chat them in. I'll be monitoring that. Even if it's not live and you're watching it on YouTube or on our Facebook page, you can still ask your questions and we will answer them because Megan and I monitor those pages. So, Dawn, do you want to start us off?
Sure. Hi, everyone. Thank you for having me today. My name is Dawn Boyles, and I'm a licensed social worker. I personally have over 30 years of social work background. It includes a gamut of things, including a 911 dispatcher, the state of Indiana Department of Family and Social Service eligibility worker, long-term care, a SHIP counselor for several years. I'm about 10 years into that. A community health worker, palliative care in a hospital setting, and currently a hospice social worker where I go to homes and nursing facilities where patients are receiving hospice care. One of the things, unfortunately, in the world, social worker kind of has a bad connotation. You know, we go take people away from their families and loved ones. That is not the case at all. As you and your family navigate the hospice journey, the social worker is there to provide a foundation for empathy and support. We are dedicated to finding the community resources to assist you with practical needs, such as funeral arrangements, transportation, power of attorney, insurance waivers, long-term placement. We also pay attention to those emotional needs and kind of the bigger picture of the family and who might be having more trouble navigating the potential loss or the loss of their loved one in the future. So we're there to support you and give you guidance and to link you to all of the things that are necessary for end of life care. When I go to a home, I always introduce myself by saying, I'm the social worker, and that's fancy for, how can I help you? What can I do to make things better? Sometimes it just means that I sit there and listen to the stories of when you were younger and how your mother took care of you and ensured your safety. Or it is, I don't know what to do. What do I do? What do I do when she passes away? Do I call the police department? No, you call hospice. Your hospice agency will be your 911, so to speak. Once you choose hospice, you are saying that you are electing to have end of life care in a home setting, whether that is home or a skilled nursing or group home setting, and that we're not utilizing the hospital. We're not doing life-saving measures. We are working toward comfort and having comfort and peace at those end days and end moments. I often also have to talk to folks about insurance, which is how we kind of connected with SHIP today. A lot of folks don't realize that when they have their Advantage plan and they become hospice eligible, they switch back to traditional Medicare. Medicare becomes the hospice payer, not the Advantage plan. Often people don't see any change in that, and it doesn't mean a whole lot to people, and it kind of happens on the backside, so you don't realize it. But some folks do get confused, especially if they do choose to go back to the hospital for some other kind of need. Sometimes you have an accident and need to go to the hospital because you've broken a bone. Well, at that point, you probably have come off of hospice. So then your Medicare will revert back to your Advantage plan. And all of those things are done on the backside. So families and patients don't really realize that those are happening. Uh, Hospice is a Medicare benefit. It does. It is a Medicare Part A benefit. It does mean that a patient has a terminal illness or prognosis that they may pass in 6 months or less. That's tough to swallow. And often when we get hospice services in there and folks are having their medication managed, having care that they need regularly in the home, we find that they live past that 6 months and still have quality days left and have a quality of life until nature takes its course. So by definition, yes, it does say 6 months. Can you be on hospice for a year, 2 years? Yes. When we look at longevity with hospice, we may look at the idea of maybe we need to move to a different form of medical care in the home. And that's where things like palliative care come into play. Palliative care is also a Medicare benefit. There are some quirks to that, if you will, but it can work with your Medicare, and you can still see a doctor with palliative care. Where with hospice, you typically do not go back and forth to the doctor or back and forth to the hospital. We manage all the symptoms at home or in your home light setting. Hospice Medicare does include essentially all the services that you need. Any medication related to your hospice diagnosis, equipment, so medical bed, bedside commode, bedside table, walker, wheelchair, oxygen, all of the things that you could possibly need at home to make yourself more comfortable and to have a quality of life. And it includes some counseling, and that's where the social work comes in. We also have bereavement counseling, and we have a chaplain on services to assist you as you navigate that hospice journey. If it's necessary, coverage can continue beyond that 6 months, but patients can also come off of hospice at any time they wish. Once you're on, you don't have to stay on. If, for instance, you think you have gotten better and things are going well, you can do what we call revoke, meaning that you come off of hospice services. Those, at that time, we remove all of the things, the bed, the commode, the oxygen, all the things. So then your medical provider has to pick those up and order those, and then they would go through your private insurance or your Medicare and your supplement insurance. When you're going to enroll in hospice, you want to shop around. There are several different hospice agencies in every community. Every one of them has their own little, good word, their own little niche, if you will, of sometimes they are able to provide music support. Maybe your loved one was a musician and would love to have somebody come in and do music. Maybe it is you still want to do some medical treatment for an unrelated diagnosis. Often that can still be handled. So all of those things can happen. It really depends. So shop around, ask questions. When it comes to eligibility, the first part of hospice, you should be Medicare Part A. Some other insurances do cover hospice care, but typically we see folks that are on Medicare. The doctor has to certify that you are terminally ill, that you have a 6-month or less life expectancy, should nature take its course as expected. You sign up for the treatments that you need, and your periods of coverage start at like 90 days, and every 90 days for the first two periods we review, and then after that every 60 days. So we're there. We have lots of services, lots of things that we can bring into the home and provide services for you. And just ask your hospice agency if they provide these things, or how can I get these extra things if I need them. Is that good, Susan, or should I continue?
I think that's terrific. You've done a great job doing some overview of how things get covered and what's involved in hospice, and especially the role of the social worker. So Megan has a presentation that she's going to share that will cover some of the same things, but some additional things that are very Medicare specific. So Dawn, if you can hang on with us in case we have questions for you, that would be terrific. But Megan, go ahead and share your presentation with us, please.
Wonderful. Thank you, Susan. And thank you, Dawn, for all of that great information. I do have a question for you, Dawn, before I go over my PowerPoint. So I've been in the case management, medical, social work field for almost 20 years. And as much as I talk about hospice and present on hospice, I don't think I am ever going to understand or remember what is the difference between hospice and palliative care.
Did I unmute myself?
You did, you did.
Okay. The difference is with palliative care, you can actually continue to seek medical treatment. You can seek curative treatment. In hospice, you're no longer seeking curative treatment and only seeking comfort measures.
Perfect.
Now, does that mean I have high blood pressure and I'm going to stop my blood pressure medicine? No. You're going to keep taking your blood pressure medicine until it's not necessary anymore. But if you're a hospice patient for Parkinson's, but have a pacemaker, you can still go see your cardiologist to make sure your pacemaker's okay. Does that help?
It does, it does. Thank you so much.
So yeah. Palliative is curative. I can still work toward curative treatments. And it may even mean that, you can still seek cancer treatments and be on hospice for some other ailment.
Okay.
So yeah, it kind of just, palliative means you can seek curative treatments and go back and forth to the doctor. Once you choose hospice, you kind of don't do those things anymore.
Okay. Easy enough. For some reason, it just never clicks in my brain. So thank you, Dawn, for that. All right, so let's dive into Medicare and hospice. So Medicare became a benefit back in 1982. And National Hospice Week was also started in 2005, so about 21 years ago. The hospice provider organization number grew to 4,000. I don't know what it is now, but there are several different hospices out there. I would think in my county, there's probably, oh heck, I don't know, 30 different agencies that provide hospice care. So there are a lot of different hospices out there. And as Dawn touched on, you do want to shop around. You want to ask questions because they may offer specialized services. And we're going to talk a little bit about that towards the end. So what makes you qualify for hospice care? So if you have Medicare Part A and you meet all of these conditions, your hospice doctor or your regular doctor certify that you are terminally ill and are expected to pass within 6 months or less. And again, as Dawn touched on, that may not happen. You potentially could be on hospice longer than that or live longer than that. And we'll touch a little bit more on that as we go along too. You accept comfort care. And in parentheses here, it says palliative care, which we know is not correct. So I'll be updating those slides. So you get that comfort care, you get hospice care instead of care to cure your illness. You sign a statement saying that you're choosing hospice care instead of other Medicare covered services for your terminal illness. And you can usually get Medicare certified hospice care in your home or other facilities. So whether that's a nursing home long-term or a hospice house, which is normally short-term, or a group home, a family member's home. There are also a very, very small number of hospice agencies that can provide care in the hospital. And I'm going to touch on that again towards the end. So what are your costs? So normally you don't pay anything while you're on hospice, but you may have a copayment of up to $5 for each prescription for your outpatient drugs that are for pain and symptom management. In some cases, the hospice benefit may not cover your drugs. Your hospice provider should contact your plan, your Medicare plan, to see if Part D, your prescription coverage, covers it. And then your hospice provider will keep you informed if any of your drugs or services aren't covered and if you will have some costs. You may pay 5% of the Medicare approved amount for inpatient respite care. Your copay can't exceed the inpatient hospital deductible for the year. And the inpatient hospital deductible for 2026 is around $1,700. Original Medicare will still pay for covered benefits for any health problems that aren't part of your terminal illness and related conditions. But this is generally unusual. Once you choose hospice care, your hospice benefit usually will cover everything you need. And then you would be responsible for room and board if you are at a nursing home. And most likely, if you're at a nursing home, you may be on Medicaid as well, and that Medicaid is helping with the costs at the nursing home. So what are some of the services you might get on hospice? Doctor's care, nursing care, durable medical equipment, medical supplies, drugs for pain and symptom management, maybe a home health aide and homemaker services, physical therapy, occupational therapy, speech therapy, social services like Dawn, dietary counseling, spiritual and grief counseling, not only for you, but also for your family. I believe this is a service of all hospices, but when your loved one does pass and you're on hospice or they were on hospice, you can get grief counseling for up to 13 months after the passing of your loved one. And Dawn, if that's incorrect, you let us know.
That is absolutely correct.
Perfect. Thank you, Dawn. Inpatient respite care. So like a nursing home, or if you are with a hospice provider that has a hospice house where you can go and get some short-term respite. Usually it's up to 5 days at a time. You can get it more than once, but it also can't be a regular occurrence. Like you're there for 5 days, you go home for 2, and then you go back for 5. And then any other services that Medicare covers to manage pain and symptom relief. So only your hospice doctor or your regular doctor can certify that you are terminally ill and have a life expectancy of 6 months. After 6 months, you can continue to get hospice care as long as the hospice medical director or hospice doctor recertifies it. Now, I have worked, again, kind of in this field for 20 some years. I've met many clients that have had a hospice, both comfort care and palliative. I've had several family members on hospice, and I've seen people on hospice for one day. I've seen people on hospice for 3 years, 4 years. Now, the longer you go past that 6 months, the more they're gonna keep an eye on your condition and your life expectancy. Um, my grandmother was on hospice for 3 weeks. My mother was on hospice for 2.5 days. My father was on hospice for going on 2 years. He is now off of it. He was in the nursing home when he had it. He had it for pain. He had uncontrolled pain, and he also had conditions that did certify him that he may not live past 6 months. However, being on hospice, and Dawn kind of touched on this too, having that hospice support in the nursing home did give him physical and emotional support. You know, we got some good pain relief control going. He had some extra aides in the nursing home, which he liked the attention, and it honestly made him more stable. And he's been off of hospice, probably about 3 years now. Pain still isn't the best controlled, but he doesn't complain about it as much as he did before hospice. So you can have hospice for longer than 6 months. Eventually, he did graduate from hospice because he became more stable. He was eating better, so he wasn't losing weight as often. And that was one of the main reasons how he got on hospice, because he was losing weight significantly on a regular basis. He was having more well-controlled pain. That pain medicine that the hospice doctor put him on stayed with his regular doctor because it was working so well for him. So he's been stable for about 3 years now and is not hospice eligible because of that. So these are some things that Medicare will not cover once you're on hospice. Treatment intended to cure your terminal illness. Now, if you are thinking about getting treatment now for your illness, which you can do, you can change your mind. You do want to talk to your doctor so you know your options, because most likely you will stop hospice. Now, my dad, while he was on hospice, he had a medical emergency in the nursing home. He started coughing. He couldn't breathe. So they called me and I said, yes, send him to the hospital. So they sent him to the hospital. They also immediately notified hospice that he was going to the hospital. So his hospice was paused. When we got to the hospital, we were in the emergency room, found out he was having a heart attack and a stroke at the same time. And we said, yes, we want to look at treatment. We want to have some testing. We want to see what's going on here because this is a new issue. So we called hospice. Hospice social worker, bless her heart, had to come out at 1 o'clock in the morning to get me to sign paperwork to stop the hospice. He got stabilized. We had a better understanding of what was going on, and we restarted hospice at the discharge of the hospital stay. So hospice resumed when he went back to the nursing home. Usually, Medicare won't cover prescription drugs to cure your illness. Care from any hospice provider that wasn't set up by your hospice medical team. You must get hospice from the hospice provider you choose. You can't have multiple in at the same time. Room and board. Medicare doesn't cover room and board if you get hospice care in your home or if you live in a nursing home. And usually that's Medicaid or private pay that will help with that. Care you get in a hospital, outpatient, like an emergency room, or care you get as a hospital inpatient, ambulance transportation unless you make those arrangements with hospice team. Now, what I will say, there are a few. I only have knowledge 100% of one agency that does this, but something that I have found, probably 4 years now, that does come with some hospice agencies is they may have a contract to provide hospice services in a hospital. When my mother went to the hospital, she was not on hospice. We were trying to figure out what was going on, her diagnosis, all that. Honestly, to this day, we don't fully have a full diagnosis of what happened. But we knew that if she did leave the hospital and went back to the nursing home, we wanted hospice. Well, we found out that the hospice agency we were looking at wanted or was allowed to provide hospice services now at this hospital, and that was brand new. So we were able to sign paperwork for her to stay at the hospital inpatient. Now she was not going to see the hospital doctor anymore. The hospice doctor took over her care, but she was able to stay there. The nurses checked on her, she got food, she got medicine there. So when we made the decision to take her off the breathing support, the hospice nurses came to the hospital, the chaplain came to the hospital, and we had the same hospice services there as we were in the nursing home or if she was in her home. So that is something to be aware of too, because we were able to still have that hospice support regardless of her location. And then contact your hospice team before you get any of these services so you understand if they are covered or not covered and you know what your costs might be. So we've touched on this a little bit, but shop around. Hospices are not all the same. They might have specialized medical diagnoses that they work with. COPD or heart care are some of the common ones I've seen. Some might have volunteer services or better or more vibrant volunteer services. Some offer therapy dogs. And then locations. I touched on the fact that some might provide services when you're in the hospital. So Dawn and I were chatting about this before we went live, but it is a known thing that some people start hospice too late. Well, why? Some may not start hospice early or because maybe they don't understand that they can get hospice earlier, or they don't want to acknowledge the fact that they might be passing under 6 months or very soon. So in 2024, about 56 to 60% of Medicare hospice beneficiaries had a total length of stay between 1 to 30 days in hospice. Roughly 20 to 27% spent 4 days or less, and only about 17% were enrolled for more than 6 months. There's that misunderstanding of the 6-month window. Hospice eligibility starts when a physician certifies that life expectancy is 6 months or less. Families may see this as a deadline rather than a starting point. There's a cultural perception. Some people see hospice as a sign of giving up, which can delay their enrollment. When I enrolled my grandmother in hospice, I let a family friend of hers know. And basically that was the response that I got from that family friend. Well, she's giving up. My parents would never have done this. Well, that's her family. And my grandmother and I and our family are choosing to get hospice for that support, physical and emotional. Complex diagnoses, dementia can make it kind of hard to predict how long you might have or to qualify for hospice. And then rapid decline. You may not expect to be passing or to pass that quickly. So that makes it kind of hard to get admitted to hospice because you've passed before that admission has started. So what happens if you have hospice early on? Routine home care is the most common level of care, so you're generally at home with hospice, and you get scheduled nurse visits, you get aid support. Early enrollment allows for more time to develop a personalized care plan, managing pain and symptom relief, provide emotional and spiritual support to families, and allow the patient to spend more days in comfort and dignity. So if you do have questions for us, Susan, are there any questions in the chat box for me or Dawn?
There are not, but I do have a question.
Wonderful.
What is, for either you or Dawn or both of you, what can you expect as far as hands-on care or number of hours of
Mhm.
personal assistance when you're receiving your benefits under hospice? Is there a limit to the number of hours you can receive, or generally what's the expectation there?
Dawn, go for it.
Okay. So unfortunately, there is not 24-hour care like people think. Typically, the nurse comes in, depending on the patient's condition, at least twice weekly and are present for a half an hour to an hour, depending on the patient's need. You also can get home health aides, or sometimes referred to as CNAs when they're in a skilled setting. But those aides come to the home. Again, it's kind of depending on patient need, but probably 3 days a week is the max. Occasionally we have a patient where we do 4 or 5, depending on the circumstances, but 9 times out of 10, they come 3 days a week to provide general hygiene care, if you will. And sometimes they will help a patient or a patient's family with minor tasks around the home, like getting the trash can out to the curb, or I don't know, switch the laundry because the laundry's in the basement or whatever. Sometimes they will do that as well. Then the social worker and the chaplain, if they are accepted by the family, also come visit about an hour a week, give or take. Sometimes those visits are 15 or 20 minutes. Sometimes they're longer. It really kind of just depends on the patient need. But really, you're only looking at 5 to 10 hours a week of people in the home. What you do have is access to a 24-hour call line. Like Megan said, that social worker that came out 2 a.m. Been there, done that. But yeah, that 24 hours, no matter what, somebody is going to be in contact with you and either at your home or at your location within a reasonable amount of time. Now, and sometimes that varies depending on your location. And we all know that here in Indiana, there are some rural areas and it takes a bit to get to. So just kind of depending on where the nurse is and where you're located. But yes, within a reasonable time, they're going to be in contact with you by phone and then for sure be on their way to you as quickly as possible. So you really have 24-hour verbal support, if that makes sense. And then that 24-hour support can also turn into tangible being present. And it really just depends on the situation. But typically a nurse 2 to 3 hours a week, home health care 2 to 3 hours a week, and then the supportive staff a couple hours a week.
Thank you very much. That does answer my question.
Thank you, Susan. That was a great question. And thank you, Dawn, for that wonderful answer. So you can contact Indiana SHIP with any of your Medicare questions or hospice and Medicare questions. Like Susan said, you can chat in our chat box. We'll monitor those. You can give us a call. You can visit us on our website, or you can follow us on social media. Susan, would you like to let us know what's coming up?
Sure. And I'll add my thanks to Dawn for joining us today. She gave a really good explanation of the role of a social worker in the hospice setting, as well as some user perspective of the hospice benefits. So thank you. And then, of course, thanks for Megan for developing the presentation for us and putting it all together. We do have our Lunch and Learn schedule posted here. So we do these once a month on Thursdays at noon Eastern time, hence the name, Lunch and Learn. And in June, we're going to talk about skilled nursing home care, how that works with Medicare, what kind of things you might be able to benefit from, what are the rules about skilled nursing care and Medicare. So mark that on your calendars for June 18th, noon, right here on our Facebook page, Eastern Time. And then, as most of you know, we do Facebook Live programs several times a month. And so the one coming up on Monday is all about end-stage renal disease. Now, Medicare has some special coverage for folks who are on who have end-stage renal disease. We also, because of the definition of how you can get Medicare when you have end-stage renal disease, we at SHIP see clients of all ages who have this disease. So tune in on Monday, this coming Monday at 10 a.m. Eastern to hear about end-stage renal disease and how Medicare covers that. And then I'll give a quick shout out to our quarterly evening webinars, live webinars. Megan and I present on all the things you need to know when you're new to Medicare, or maybe some information about, do I sign up for Medicare and how does it work and how much does it cost? And we do those in the evenings. And our next quarterly presentation is coming up on June 18th at 6 p.m. Eastern Time. Now, we don't do that on Facebook. It's because it's a live webinar. So we use Eventbrite. And so if you just go to Eventbrite and then enter in Indiana SHIP, you'll see it pop up and you can register. And just like all the other services and programs that SHIP provides, it's free, and we do offer impartial information about Medicare and all the related insurances. So we will wrap it up today. Thank you, ladies, and thank you all for tuning in or listening on the rebound. And if you have questions, reach out to us. We're happy to help you understand. Have a great day, everyone. Bye.